Now, what are the type of helminths? Helminths are 3 cestodes, trematodes and nematodes. এইটা একটু সরিয়ে দিলেই তো। And nematodes divided into 2 parts. One are intestinal nematodes and other is tissue or somatic nematode. So today's class is about the intestinal nematodes only. Intestinal nematodes will be covered in today's class. But before we go to the proper topic, intestinals, just for the few names, what are the cestodes? Tinea solium and Tinea saginata, Diphyllobothrium latum. Intestinal trematodes are Fasciola busci and blood fruits are Cystosoma. This will be taken in other classes. Right. Now, among the intestinal nematodes, intestinal nematodes are divided into 2 parts. One are intestinal, that is divided into large intestine and small intestine, and tissue, filarial worm, Trichinella, these are tissue. So what are the small intestinal nematode? Ascaris, Hookworm and Strongyloides. And large intestine are Trichuris and Enterobius. Now, have you heard the name? What is oviparous, what is viviparous and ovoviviparous? Which are oviparous, which are ovoviviparous and which are viviparous? All the intestinal nematodes are either oviparous or ovoviviparous, and all the tissue nematodes are viviparous. Now name one example of ovoviviparous. Which one is ovoviviparous? Ovoviviparous, Strongyloides is the example of ovoviviparous, Strongyloides. So these are the things you should know, because Ascaris, Hookworm and Strongyloides this is also important for your specimen. Ascaris specimen is there and also Hookworm specimen. Thank you. Same thing. What are the classification? Intestinal nematode infection. So already covered Ascaris, Hookworm or Strongyloides are small intestinal and large intestinal are Trichuris and Enterobius. So Filaria, Luceria, Brugia, Loa, this will be covered in the next Tuesday class, and Trichinella. Oviparous, following fertilization, female worms produce eggs that take some time to hatch out and most of the intestinal nematodes are oviparous except Strongyloides. Strongyloides is ovoviviparous. Viviparous directly give birth to larva, there is no egg stage. Most of the somatic nematodes are viviparous. Filaria, Trichinella and Dracunculosis, they are viviparous. Ovoviviparous lay eggs containing larvae which immediately hatch out, Strongyloides species. These three you should remember, these are also asked in the oral and it can come as short note also. So these three, viviparous, ovoviviparous and oviparous. So this is the overall morphology of nematodes. What is the difference between cestodes and nematodes? Can anybody tell cestodes and nematodes? Cestodes are usually hermaphrodite, but nematodes, male and female, exist separately. This is the one differential point. So, male worm and female worm, adult fertilize to produce eggs, eggs hatch out larva. There are at least 4 molting to reach the adult worm. These 4 molting at different stages, it may be in the soil, it may be in our body, and it is different for the all nematodes. It is not same, it is molting, but you should remember the term molting that occurs. So adult worm, female worm is usually longer and then the male worm, and there are different, there is ejaculatory duct and these spicules are there for male, and in female there is a vulval waist, and this is the part. Now, before I go to the all the worm, there is some shortcut to remember the life cycle, because life cycle you should remember. How you should remember the life cycle? There are 2 parts. One is T, that is Trichuris, Enterobius and Ascaris. Life cycle is almost same, except the Ascaris goes through the lungs, other two do not go through lungs. So the thing is that this Ascaris, there is a lung molting or it goes through the lung, but other two does not. How? The adult worm, first is larva. Larva to adult worm. Male, female, fertilization, egg. This egg is there in the soil, and that is also the infective form and diagnostic form. Now, what is the difference between the embryonated egg and non-embryonated egg? In which nematodes the embryonated egg is the infective form and the diagnostic form. Only in Enterobius, the embryonated egg is also the diagnostic form and infective form both. But in Ascaris, the diagnostic form is unembryonated egg. That you should remember what you see in the stool specimen. The Ascaris is an unembryonated egg, but molting occurs in the soil. So this is the main part, and in Ascaris, what's the extra part? This larva goes to intestinal lymphatics, to right heart, to lungs, and there is a 2 molting occurs at lungs. So 1 molting at soil, 2 molting at the lungs, and 1 molting in the intestine. For Ascaris, there are 4 molting. This is usually asked in Viva. How many molting occurs in Ascaris? There are 4 molting, 1 molting in the soil, then 1 molting in the intestine, and the 2 moltings in the lungs. So Trichuris, let's start individually, also known as whipworm. Why it is called whipworm? Because the female worm looks like a whip. The female Trichuris worm looks like a whip. It is a soil transmitted helminth. Trichuris has several other species. It is a worldwide distribution. Children are commonly affected. Adult larva 4 stages. Adult worm resembles the handle of a whip. It's called whipworm. So this is the life cycle. You can see the infective form is embryonated egg. In this case, embryonated egg develops into larva, into adult worms, fertilization and male-female. Distribution, unembryonated egg in the feces is the diagnostic form, but in Enterobius, the embryonated egg. The life cycle is simple for Trichuris. Incubation period 0 to 90 days. There is eosinophilia. Adult female worms get buried in the large intestinal mucosa. What it can cause? What are the symptoms of Trichuris infection? Either it can cause a Trichuris dysentery because it is there in the large intestine and can cause Trichuris dysentery, inflamed edematous and friable mucosa. Abdominal pain, Trichuris dysentery syndrome, iron deficiency anemia, recurrent rectal prolapse. How will you diagnose? Stool. In all these parasites, in nematode, you have to look for the stool examination. What is usually done, this is same for all the nematodes. Stool, there are two mounts, either a normal saline mount and an iodine mount. And in some cases, we need to use some concentration method. Concentration method. What are the concentration method? You already had a class. What are the concentration method used in stool? Concentration methods in the stool. Either it is some flotation method or sedimentation. That will be taken in the practical class when we read stools, the concentration method of stools, then read. So single stool specimen is sufficient for diagnosis of symptomatic case. Now look, this is the egg of Trichuris, and this is a female worm, looks like whip. How will you describe the Trichuris egg? It is a barrel shaped and mucus plug on both sides. This is a mucus plug and this is a mucus plug. So this barrel shaped egg, and it is bile stain, also bile stain. There are few ova which are bile stain, which are not bile stain. Can anybody tell which ovas are bile stain, which are not? Non-bile stain is a mnemonic there is called NEHA. That is Hookworm, Nicator, Enterobius, Hymenopus nama and Ankylostoma. So Hookworm ova and Enterobius vermicularis and Hymenopus nana, these are the non-bile stain ova, non-bile stain. And the bile stain are TAT, P-A-T-T. That is Ascaris, fertilized and unfertilized, Trichuris and Tinea. So these are the bile stain ova and these are non-bile stain ova. Why they are bile stain? Some are bile stain, some are not bile stain. That is due to two things. One is the lipid content of the egg and the cell wall, egg wall, and the bile receptor. That is controversial, but some people say there are bile receptor in the walls of these egg. That's why they are bile stain. And other things are which ova floats and which ova do not float. Which ova floats, which egg floats in the saturated salt solution. This is equal for all nematodes. There is a mnemonic called Fateh floats. That means fertilized egg of Ascaris, the Hookworm, Ankylostoma, the Trichuris, Enterobius and Hymenopus nana. These eggs usually floats in saturated salt solution. There are two concentration methods, one is flotation, one is sedimentation. These ova can be diagnosed by flotation methods also. Those does not float cannot be diagnosed by the flotation concentration method. So this is Trichuris trichura. Next, peripheral blood eosinophilia, increase IgA level. In most of the cases, the albendazole or mebendazole is the drug of choice. Enterobius, common parasitic infection in children. It is also called pinworm. 209 million people are infected by pinworms. Most common is school children group. Overcrowding, impaired hygiene, poor personal care. Now this is the life cycle is same as Trichuris trichura, but what is important, the infective form is embryonated egg and also the diagnostic form is also the embryonated egg. In only Enterobius, both are embryonated egg. Both the diagnostic form and the infective form are embryonated egg. And there are another mode of infection, that is auto-infection. Auto-infection, as the eggs which are embryonated can lead to auto-infection. So how the auto-infection occurs? Due to poor hygiene. Clothes, bed, linen and poor personal hygiene lead to auto-infection in Enterobius. Two types, exogenous auto-infection by transferring eggs to mouth with hands that have scratched the perianal area, and endogenous auto-infection by retrograde migration. Ingestion of eggs in the environment through contaminated finger. So these are the two modes of infection. Female children, young adults are often symptomatic. Perianal pruritus is the only uniform symptom, and that is worse at night. So rarely pinworms invade the female genital tract, causing vulvovaginitis or peritoneal granuloma. Now microscopy, how will you take the sample? Remember this term NIH swab, National Institute of Health, because this may come as short note. NIH swab, this has come several times as short note. NIH swab, that is for diagnosis of Enterobius vermicularis or pinworm, and when the swab is taken by two methods, either a cellophane tape in the perianal area or with a NIH swab is rubber stopper, glass rod, test tube and rubber band and the cellophane. So this is the NIH swab. When the sample is taken either in the evening or in the early morning, because the Enterobius female worm usually is not migrate intermittently. They are not always present in perianal area, they are present intermittently. So 4 to 6 samples to be taken, to be collected late in the evening or in the morning. The female worm lay eggs in the perianal area and these eggs are embryonated eggs. So these to be mentioned in NIH swab. First mention, this is a swab when it should be taken. It is the National Institute of Health, that is the full form, and the time of taking the swab and what you will get. That is egg and that is also embryonated egg. Now how the looks of Enterobius? This is a pinworm and this egg. Whether it is bile stain or non-bile stain, I have already mentioned Enterobius. Enterobius is not bile stain, it is plano-convex. That is plano-convex, one side is flat and another side is convex, and it is non-bile stain. Treatment, that is either mebendazole or albendazole or pyrantel palmoate can be used. Same treatment should be repeated after 2 weeks. Improving personal hygiene, Ascariasis. It is the most important for your oral purpose because Ascaris specimens are there and usually asked how to identify and what are the diseases caused by Ascariasis. So, infection of the small intestine caused by Ascaris lumbricoides. It is the largest nematode, commonly called also roundworm. It is also a soil transmitted helminth. Now Ascaris you can get in the stool both fertilized and unfertilized egg. How? Can anybody tell how we get the both fertilized and unfertilized egg in the stool? Because it is one of the largest nematode. So female is so long that there are some fertilized and unfertilized eggs both passed in the stools. Female release, as it is too long, all the eggs may not be fertilized, but they are released by the female Ascaris in the stool. That's why we get, so this is due to the largest nematode parasiting human intestine. So typically occurs through fecal. What is the infective form? In all these things you should know what is the infective form, what is the life cycle, what are the symptoms, and what is the treatment. These 4 points about all parasites. The life cycle you should know one part, another is what is the infective form. This is different for, so risk factor children and malnutrition. What is the infective form? Adult larva and eggs, these are the 4 forms. Adult worm is cylindrical, measure 15 to 31, maybe up to 35 centimeter. Female leverette, already I have mentioned, fertilized and unfertilized egg. What is the infective form? So here man acquires by infection of the contaminated soil food with embryonated egg. So embryonated egg is the infective form. Embryonated egg is the infective form. It is rhabditiform larva hatches out from egg molting, and then larva penetrates the intestinal wall. It goes to intestine, do portal sulfuration, then the right side of the heart to pulmonary capillary lungs. Then again swallowed into small intestine, develops into the adult worm, fertilization occurs, unembryonated eggs passed in the stool. So these are, the diagnostic form is unembryonated egg, but the infective form is embryonated egg. This you should remember. Now what is the symptom in lungs? Can anybody tell? So again these are the part already covered. So pathogenesis depends on the host immune response, migration of larva, mechanical obstruction, nutritional deficiency. So this part you should remember, Loeffler syndrome. It has come several times as a short note. When the Ascaris larva passes through lung, it causes an eosinophilic pneumonia. Eosinophilic pneumonia, patient will present with non-productive cough, shortness of breath, chest discomfort and fever. So there will, if you examine, there will be rhonchi, obstructive features, eosinophilic pneumonia, Loeffler syndrome due to the passage of larva of Ascaris through lungs. So Loeffler syndrome, you must mention these 3 points. So these is immune mediated hypersensitivity response. Migrating larva in the lungs, Loeffler syndrome. What you will get in peripheral blood smear in Loeffler syndrome? There will be eosinophilia. It is already eosinophilic pneumonia is there. So you will get an eosinophilia in the peripheral blood. Patient may present as a shortness of breath, and it is a hypersensitivity response. Intestinal phase may be asymptomatic. Intestinal complication, allergic manifestations like fever, urticaria and angioneuritic edema. Can anybody tell what vitamin deficiency occurs in Ascaris infection? What vitamin patient with Ascaris infection? And which worm causes, it is not B12. Most of the student answers B12. B12 deficiency is caused by Diphylobothrium latum. Ascaris causes vitamin A deficiency that lead to night blindness. Vitamin A deficiency occurs in, so pneumonia I have already mentioned, visceral larva migrans, if there is a abdominal discomfort, vitamin A deficiency, intestinal obstruction, particularly in the children, and the term you should remember intersusception and volvulus. Intersusception is the commonest mode of intestinal obstruction in children with huge Ascaris infection. It may even move to bile duct, lead to cholangitis. This part can occur in Ascaris. So Ascaris can penetrate through intestine and cause peritonitis also. So 3 points. It may be asymptomatic, that is anorexia or indigestion, present like that, or it may present as intestinal obstruction in children. What is intestinal obstruction? Usually intersusception and other nutritional deficiency. Vitamin A deficiency occurs in Ascaris. These are the 3 points you should remember about Ascaris. Sometimes appendicitis, cholecystitis, biliary colic and cholangitis can occur due to ectopic ascariasis. Now, egg detection. Both fertilized and unfertilized eggs are detected in the stool, and concentration technique by sedimentation method. Flotation method for stool concentration not preferred, as unfertilized egg do not float. So, Fateh means fertilized egg only floats, so unfertilized egg does not float. So, if you use the flotation technique of concentration, you will not get the unfertilized egg. So, that's why sedimentation method. Already you had an introductory class. Which is the most used concentration method? Most used concentration method. FEA. Previously it is formalin ethyl acetate. This concentration method is most commonly used. FEA, formalin ethyl acetate. Previously it was formalin and ether. Now it is ether is not used. So FEA concentration method is used for the detection of stool. Now this is the difference between fertilized egg and unfertilized egg. It will be more important for your practical class if stool is there. Fertilized egg is round or oval, but unfertilized egg is rectangular and longer. This is bile stain and there is mammillary coat, protein thick translucent cell with outer albuminous coat. And outer coat sometimes contains large unsegmented ova, clear crescentic area at the pole, floats in saturated salt solution. So how it looks like? This is the fertilized egg and this is the unfertilized egg, sometime atrophied ovum, and this is the mammillated albuminous coat. Ovum is unsegmented, there is a space between the unsegmented ovum and the outer coat. So this is fertilized egg and this is bile stain, and fertilized egg also floats in the normal salt solution. Atrophied ovum or this is unfertilized. This is a normal saline preparation. You will see like this. When you examine stool in the practical, this will look like this. This is eggs of Ascaris lumbricoides and this is unfertilized and this is decorticated. These are the 3 types of eggs. Occasionally adult worms are detected in the stool or sputum. Barium nil X-ray may demonstrate adult worm in the intestine. When the 2 worms are lying parallel, trolley car line appearance may occur in X-ray. So this is adult worm. Serological method, though not done regularly, by antibody detection, by ELISA or other format. It can cross-react with other helminthic infection, mainly useful for sero-epidemiological purpose. So usually not done for diagnosis. Now PCR, there is a multiplex PCR developed to detect between Ascaris, Trichuris and Hookworm. Multiplex PCR, but mention it at the last. So stool examination, you need to mention first and in detail. Eosinophilia is prominent during early lung phase but disappears later. Now treatment is albendazole or mebendazole. Drugs like ivermectin and nitazoxamide are also effective. In pregnancy, parenteral palmate is safe. So partial intestinal obstruction managed with nasogastric suction, complete obstruction with severe complication requires surgical intervention. So this is the treatment. Hookworm. Why hookworm is notorious? Why we should know hookworm in details? Due to the hookworm. What is the main clinical features of hookworm infestation? Hookworm, what is the main manifestation? Anemia. It causes anemia due to blood loss. So hookworm, the main cause of our concern is anemia. So when you get in a village or in a tropics patient presenting with anemia, along with the iron, you should prescribe an anti-helminthic drug also, because you always cannot get the hookworm egg in the stools. So this is the point. Anemia patients should have a deworming. So hookworm is one of the important cause of iron deficiency anemia both in tropics and temperate country. Another soil transmitted infection. Ankylostoma duodenale or old world hookworm and Necator americanus or new world hookworm. There are two types of hookworm, Ankylostoma and Necator. Several other, Ankylostoma brasiliensis, Ankylostoma caninum and Ankylostoma cilium. Why these are important? Ankylostoma brasiliensis, Ankylostoma caninum. Have you heard the term larva migrans? Another short note on explain why question, what is larva migrans? How the infection of the hookworm occurs? So if we go to the Necator is more common, which is more dangerous? Ankylostoma or Necator? Which causes more blood loss? Ankylostoma causes more blood loss than Necator. Heavily infected areas are Assam, West Bengal, Bihar, Odisha, Andhra Pradesh, Tamil Nadu, Kerala and Maharashtra. So that's why I have told if you get a anemia in West Bengal, also do a deworming. So one of the highly infected states are Assam and West Bengal. Males and young adults commonly affected due to iron loss. Most severe in children. What is Chandler index? Used in the epidemiological study to estimate the morbidity and mortality in the community due to hookworm. So this is also called an endemic index or Chandler index. Three morphological form: adult, larva and egg. Ankylostoma and Necator differentiated by morphology and third stage larva. How they are differentiated? By adult form and by third stage larva. Eggs and first stage larva are same in both. Adult worm is small, 13 mm, has a bend in the anterior end, that's why it is called hookworm. They are differentiated by the buccal capsule, number of teeth and cutting plate. I will come to that table. There is a table differentiating between Ankylostoma and Necator americanus in the last. So this is the life cycle. The cycle is almost same for Strongyloides and hookworm. Very difficult to understand from this small writing, but it is. What is the infective form? What is the infective form in case of hookworm? That is L3 larva or filariform larva. Filariform larva is the infective form. How it enters human body? How it enters? Previous intestinal nematodes enters through the fecal route. It enters through skin penetration. So there is a skin penetration. Both hookworm and Strongyloides enter through the skin penetration, and by skin penetration they reach L3 filariform larva, they to venous circulation through lungs, again swallowing in the sputum, reach GIT, and larva develops into adult worms, male and female, fertilization occur and unembryonated egg is the diagnostic form. So in case of hookworm, so L3 is the infective form, is goes to skin penetration, by lymphatics goes to venous circulation, then to lungs, it is swallowed back to intestine and it divided into male and female, and fertilization occurs that lead to egg, and this egg, whether it is the infective form, it is unembryonated egg again. So this is not the infective form. This larva is called, in L1 containing larva, this egg contains L1 larva, and that is not the infective form. The infective form is L3 larva or the filariform larva. So unembryonated egg, and this is called L1. Have you understood this part? This L1 and L3 larva, and why the larva migrans? Ankylostoma braziliensis or Ankylostoma caninum, which are not human parasite. Caninum is a dog hookworm. When they enter, they can enter the subcutaneous tissue by penetrating the corneal layer of the skin. Corneal layer of the skin they can penetrate by releasing hyaluronidase enzyme, but they cannot penetrate further and they cannot reach the lymphatics so that further process occurs. So larva migrans, due to the infection of non-human hookworm, that lead to subcutaneous creeping eruption will be there, and larva moves to subcutaneous plane. They cannot enter the lymphatics and cannot go to venous circulation. That's why it is called larva migrans. Larva migrans is caused by, so it is very rarely caused by Ankylostoma duodenale or Nicator. It is usually caused by Ankylostoma braziliensis or Ankylostoma caninum, because they cannot penetrate further to reach the venous circulation. So that's why they remain in the subcutaneous plane, causing larva migrans. So male, female is longer than male as in the most parasite, and posterior end is expanded in umbrella-like fashion called copulatory bursa, tapering as there is no expanded bursa. If hookworm is there in the sample, the specimen, you may be asked how will you differentiate? It may not be, this is so small, you cannot see properly this part, but remember this part, the umbrella-like fashion copulatory bursa in the male, and there is no expanded bursa, only tapering in the female. Posteriorly opens with cloaca and present at the junction of posterior and middle thigh. So this is the this is the difference between male and female ankylostoma. Hookworm has the ability to suck blood from the intestinal vessels, which occurs in several ways, attaching and making cuts in the intestinal wall by buccal capsule and teeth, secreting hydrolytic enzyme, and another point, they release some anticoagulant. So bleeding does not stop of its own. That is due to cause of anemia. So there are three causes of anemia. One is they can suck the blood from the intestinal vessel. They can make cuts in the intestinal wall by buccal capsule and teeth, and secrete some hydrolytic enzyme which contains anticoagulant. Ankylostoma is more pathogenic than Nicator because of its larger size. Blood loss, you should remember what is the blood loss? 0.26 ml. That is, if you cannot remember, 0.3 ml, 0.2 to 0.3 ml is ankylostoma, and in Nicator is 0.03 ml. So it is more than 10 times in case of ankylostoma. And there is increased T helper cell 2 response leading to increased antibodies such as IgG. So what are the features? One is where skin penetration occurs, there may be creeping eruption or the ground itch, and serpiginous tracts of the larva migrans may occur. Mild transient pneumonitis may occur, early intestinal phase, less worm load, and late intestinal phase. Now, stool concentration method, stool sample that is not fresh, the eggs may not hatch out to see the larva. Larva can be seen. If larva is seen, it should be differentiated from Strongyloides larva. Egg counting. At least remember the methods of egg counting. If you don't know the details, so Cato-Cat's technique, direct smear method and modified Stoll's dilution methods are, this is in details given in K.D. Chatterjee's book, How Will You Count the Egg? K.D. Chatterjee's parasitology book, at least you see once from the library, and there is a picture, one-page picture for all the eggs and how it look like. So this is the egg. Now what is the characteristics, features of hookworm egg? Hookworm egg is non-bile stem and there is segmented ovum. This is called segmented ovum. There may be 4 to 8 segments. These segments are called blastomeres. So 4 to 8 segments in the hookworm and it is non-bile stem. So hookworm is there in our stool sample, may be asked in the exam. So segmented ovum, there is 4 to 8 blastosmere and it is non-bile stem and this is the rhabdiform larva. So here again the diagnostic form is unembryonated egg, larva L1 if you get, and the infective form is L3. So that is we don't get in the stool. What we get in the stool is non-infective form but diagnostic form. The diagnostic form is unembryonated egg or L1 larva containing. So this is one WHO classification, eggs per gram of the stool, what is called light, what is moderate and heavy infestation. Freshly prepared stool sample, eggs hatch out to develop L3 larva in 5 days, differentiate. Various culture technique, also they can be cultured. Harada Mori filter paper method, bare funnel technique, charcoal culture and agar plate technique, more sensitive. So Harada Mori was initially used for the culture of hookworm, stool culture. It is not the bacterial culture, it is the culture for parasite. Culture for parasite, you should remember the Harada Mori filter paper technique that is asked in the oral. What is the method of culture for stool culture for hookworm? And you can get L1 and L3 larva. So this is the difference between Ankylostoma duodenale and Nicator americana. Ankylostoma duodenale larger and thicker, that's why blood loss is more, bends in the same direction as the body curvature. Nicator bends in the opposite direction. Buccal capsule, there is 6 teeth and there is no teeth but 4 chitinous plate. So teeth are present in Ankylostoma duodenale, blood loss is more. Copulatory bursa, there are 13 rays and in Nicator it is 14 rays. Posterior end, there is spine is absent in Nicator but present in Ankylostoma. Valval opening behind the middle of the body and front of the body. And pathogenicity, more pathogenic and less pathogenic. What? This part is asked, same direction as the body curvature. It can be seen in the specimen. It is the same direction as the body curvature. In Nicator, it is the opposite direction, the hook, final hook, the bending. Why it is called hookworm? There is a bending in the anterior part that is same as the body curvature in Ankylostoma, but it is opposite in the case of Nicator americanus. This 6 teeth is not visible from the specimen, but you must remember teeth is present in Ankylostoma and chitinous plate is present in Nicator americanus. If you don't remember all the number of teeth, number of hook, at least remember this part. Other PCR can be done. Laboratory diagnosis, hypochromic microcytic anemia, eosinophilia, hypoalbuminemia. So this is the hookworm in the small intestine. The small hookworm you can see, this is the small hookworms in the intestine. Iron deficiency already migrating larva and adult worms. This may be one patient presenting with severe hookworm infection leading to puffy face, pedal edema. Why there is pedal edema? Can anybody tell? In patient with hookworm, there may be pedal edema. In severe hookworm infestation and long-standing anemia, there was 2 points, that was iron deficiency anemia and hypoalbuminemia. This edema is due to less albumin. Hypoalbuminemia leading to pedal edema and growth retardation also. Albendazole and mebendazole, resistance to albendazole are also reported. Mild iron deficiency anemia, treat with iron and folic acid. Severe hookworm disease with protein loss and malabsorption, nutritional support is needed. Now soil transmitted, there sometimes short note about soil transmitted in helminth. What are the 3 soil transmitted helminth? That is Ascaris, Trichuris and Hookworm. Now we will go to the last. They are high risk for preschool children, infected children, nutritionally and intellectually, physically impaired may lead to soil transmitted infection. Deworming, periodic deworming to prevent high risk people from one infestation, the National Deworming Day. Every year 10th February and 10th August are World Deworming Day. 10th February and 10th August. Now strongyloides, this is the last part. Strongyloides is important for this is also called military worm. Similar to other nematodes, Strongyloides circularis exists in 3 forms. What is this? Ovoviviparous or viviparous or oviparous. So this is only example of ovoviviparous. What is the diagnostic form? Egg or larva. In Strongyloides, as it is ovoviviparous, the larva is the diagnostic form. The larva is the diagnostic form and this is the life cycle. This is some complicated life cycle for strongyloidosis. So this thing can occur as in case of hookworm, the L3 larva, venous circulation, lungs, larva develop into adult female worm. There is one part, in strongyloidosis, in human intestine, you don't get male. Male strongyloidosis is not present, then how the eggs are fertilized? How the eggs are fertilized in strongyloidosis? In strongyloidosis, eggs are fertilized in human body by a term called parthenogenesis. That is asexual fertilization. Parthenogenesis. So, in strongyloidosis, there is no male worm in human body. Male worm is not found, so the fertilization occurs by parthenogenesis and female worms lay eggs, molting occurs in the intestine and the L1 larva in feces. This L1 is against unmembranated rhabdidiform larva. This is not the infective form, this is diagnostic form. L1 or rhabdidiform forma is the diagnostic form, not the infective form. Other methods of development, this is one in human body. Other that may go into this L1, go into L2, L3 and adult worm lay eggs, again lead to L1, L2 and L3 infective form. This is called indirect development. This L1 goes into soil, transform into L2 and L3. They transform into adult worm, male and female. So in outside the human body, male worm can be seen. And this is indirect method. They again fertilize, lay eggs, transform into L1, L2, L3. This is another method. Another is direct development. That means this L1 larva transform into L3 and that transform L3 goes as an infective form to human. So there are 3 modes of development in strongyloides. One is in human body by parthenogenesis, that is asexual fertilization or parthenogenesis, the eggs are released. One is indirect method, that L1 into the soil, L1 molting occur, L1, L2, L3, then it forms the adult worm. Then again, after eggs, and it transforms into L1, L2, L3, and L3 is the infective form. Otherwise, this L1 develops into L3 and it acts as the infective form. So there are three methods of life cycle. In Strongyloides life cycle, you mention all three methods. In Strongyloides life cycle comes. Now this is the same, I am not repeating. Adult worm is 2 to 2.5 millimeter, it is ovoviviparous, so we usually don't get eggs, we get larva. Mode of transmission, penetration or auto-infection. Effect due to migrating larva, there may be asymptomatic infection, cutaneous larva migrants can occur, serpiginous articulated rash, pulmonary symptoms is usually uncommon, mild to moderate worm load, adult worms and larvae traversing the upper bowel mucosa may produce epigastric pain. Another term is hyperinfection syndrome. Short note has come previously about hyperinfection syndrome and disseminated strongyloides. Can anybody tell in which patient hyperinfection syndrome occurs? In which patient have some pre-existing disease where hyperinfection syndrome occurs? Not in all. Not in all patients hyperinfection syndrome occurs. This is hyperinfection syndrome. Repeated auto-infection cycle. How the auto-infection occurs? By reverse peristalsis. Larva itself moves into L1, L2, L3 in our body. That leads to auto-infection and the larva penetrate, migrate to various stages. Now impaired host immunity and glucocorticoid therapy. So you remember the two. One is HTLV1. HTLV1 infection and steroid therapy. Patient on glucocorticoid. These are the two type of patient where the hyperinfection syndrome occurs, and also in HIV patients, but with less frequency. So these are the three types of patients where hyperinfection syndrome occurs. One is HTLV1, patient on glucocorticoid therapy, and also in HIV patient. Colitis, enteritis and malabsorption, disseminated strongyloides may occur. Larva may invade GIT and to migrate to other organs like CNS, peritoneum, liver, kidney. CNS invasion, brain abscess and meningitis are common. Larva can be seen in CSF occasionally. Eosinophilia is often absent in severely infected patients. Mortality rate in untreated patient is 100%. And even with treatment may exceed 25%. So hyperinfection syndrome is a notorious mortality, even if you treat, is 25%. Stool microscopy, characteristic rhabditiform larva, performed to increase the yield, concentration technique. Single stool examination is 30%. So this is the rhabditiform larva in iodine mount. Rhabditiform larva in Strongyloides sulcuroides. How will you differentiate rhabditiform larva from hookworm? That is from Strongyloides is from hookworm. The size of the hookworm larva is 100 to 150, but Strongyloides larvae is 100 to 400, 380 and 3 times longer and shorter in mouth. Mouth is longer in case of hookworm. Genital primordium is less prominent and anal pore is 80 micrometer from the posterior end and 50 micrometer from the posterior end. So one thing, the Strongyloides larva is larger and thicker. This is the double bulb esophagus and buccal cavity, anal pore, and this is the hookworm and Strongyloides larva different. So what are the difference? 80 micrometer from the posterior end and that is 50 micrometer. Anal pore is closed in case of Strongyloides. How will you diagnose enterotes? Diagnose by examining stool, sputum or any body fluid. Again, Harada-Mori filter paper method for stool culture, Bierman funnel technique and agar plate technique is more sensitive. ELISA using crude larval antigen. Antigen capture ELISA developed using polyclonal rabbit antiserum. Real-time PCR can be done. Even in asymptomatic stage, strongyloidosis must be treated because of potential subsequent fatal infection. What is the treatment? Ivermectin 200 milligram per kg daily for 2 days, more effective than albendazole. So ivermectin is more effective, but albendazole can be used. Parasite affecting monkeys, this should not be other part. So stool examination you at least should read, and there is all infective form are not diagnostic form. Only Enterobius, the diagnostic form and infective form are same. Otherwise all cases the diagnostic form is unembryonated and the infective form is embryonated. Now what is the infective form of hookworm I mentioned? Hookworm and Strongyloides, what is the infective form? What is the infective form? L3 larva, at least you have forgotten just now. L3 larva for hookworm and Strongyloides, L3 larva.